Hello and welcome to the Digital Health Hubcast. I'm your host, Hannah Clemmens, and this week I'm joined by Lorenzo Gordon, a software developer turned co-founder who has been leading innovations in health, social care, housing and education for over 20 years. Lorenzo has developed a myriad of innovative solutions in the digital health space, and in this discussion we explore how the digital technology landscape has evolved over the last 2 decades, and Lorenzo shares what he wished he'd known at the start of his career. Welcome, Lorenzo. It's really good to see you. How are you doing today?
Thank you for having me. I'm really pleased to be here, and it's such a nice sunny day to be walking around Sheffield.
It is. Yeah, we love it here in Yorkshire. So let's start. Tell me a little bit more about yourself, Lorenzo.
So I started my professional life as a computer programmer way back in the prehistoric 90s when I was programming databases, and then as it emerged, kind of websites, working for a university in London that was focused on health and health research, and eventually decided to become a freelancer, I think because I found it quite restrictive and frustrating working within large organizations, and I wanted the freedom of being able to kind of control what I was doing and how I was doing it a little bit more. And very generously, that employer became my first client. And since then, kind of worked with friends and created a business that was around how could you take digital technology and be creative with it, do inventive and kind of different things with it, but also do it in a way that served industries that we felt historically had been poorly served by a small number of large providers that were charging a lot and delivering very little in the public sector. So that was around education and housing, but overwhelmingly around health research and social care.
Yeah. Can you think of any examples?
Yeah, I mean, it's not digital health, but one that springs to mind was we worked in housing with housing management organisations, housing associations and housing cooperatives. And at the time, your choices if you wanted to use digital technology, and this was back in the early noughties, so quite a while ago, was either using very, very expensive old systems from suppliers who were very big companies who were really just trying to generate as much income with as little work as possible, or one-man band outfits who had developed access databases. And the web and web technology and the idea of databases was getting quite well established at that point. And so we were able to develop much more effective cloud software that was much cheaper and much more accessible to people who didn't want to and didn't like and weren't interested in technology and just wanted to be able to live in their housing communities well. And we were able to link that up to these legacy systems so that the data could flow. And we did that in quite creative ways by reverse engineering databases and understanding data structures to avoid what those consultancy companies were charging, which was, upwards of £1,000 a day for the same type of work, which was, we just thought, daylight robbery.
Yeah, that sounds really nice. So it's going to be great to talk to you a little bit more and draw on that kind of experience over the last 20 years of working within technology and health tech. So I wonder if you can speak a little bit about how that landscape has changed.
Well, I mean, dramatically, unrecognisably, I would say. When we were getting started, it's a bit of a cliche, but it's true that people were still using pagers and fax machines, and most things were written down. Records were generally paper-based records. Most systems, as in most healthcare systems, did not use electronic patient records. And in a way, it enabled, because it was a bit more of a Wild West, it meant that you could get slightly maverick managers or clinicians to employ people like us in a single department, for example, in radiology or in health research to build a standalone system that worked, because you weren't competing with anyone else. You weren't treading on anyone's toes at the time. So there was a lot of freedom to do things, but it was very difficult to then get the sort of adoption and spread that you might want, because all the solutions you were producing were so localized to the environment you were working in. And I think almost all of the changes that have happened have been massively for the better in that time, and the way that we now have digital systems that are able to, starting to be able to share data and transfer with the individual as they move between different, for example, primary care and secondary care. What that has also brought with it necessarily is a huge amount of legislation and governance, which is necessary, and I think broadly is a positive thing. But what it does do is it makes it harder to be innovative, I think. It makes it much, the barrier for an SME now to get involved in that is much higher, and the implication, therefore, of it is that you need a lot more money to do it. You need a lot more time and patience, and you need to have a quite different mindset as somebody leading the organisation. In our day, we were really not businessmen. We were guys who knew how to use technology and wanted things to be more equitable and accessible, and we were not commercially minded. And these days, I think all of those are a prerequisite, not necessarily for an individual, but certainly for the organisation. You need to have that from the get-go, because you need to understand how you are going to engage with these large-scale systems and understand what their concerns and pressures are in order to make your solution land and stick. And these were just simply things we didn't have to think about in those days.
Yeah. So it's a more complex and bigger task these days. Is that what you mean?
Yeah. Way more, and much more professionalised in a way that I think in those days it was possible just to be a few developers and effectively cobble things together that were good, but were just kind of working with local systems. These days, I don't think that would fly certainly not in a highly regulated industry like healthcare.
Yeah. So you'll need at the moment to gather, I think one of the biggest challenges health tech creators face is getting enough patient data to prove that your innovation works in a particular environment. Do you agree?
I think that's certainly one of the biggest challenges. One of the first questions you will be asked when you're maybe a couple of steps into your journey and you're trying to engage with healthcare systems is, where have you already done this and what are the results of this, which speaks to your point about getting the data. And there are, of course, ways around that and ways to build in that working partnership from the start. I think whether it's actual individuals, there are, as a very basic kind of, there are three elements that you need in a startup now if you're going to work in healthcare, which are, obviously you need sort of the technical creativity, being able to understand the problem and respond to its side. You need a very strong handle on sort of more professional side around governance and clinical safety and understanding what digital assurance looks like within the healthcare space. And then you need, on the more sort of marketing side, an ability to understand both where your target market is and also what are the barriers likely to be and what are the keys to unlocking some of those doors from the very start, because you need to be baking in your approach to addressing those from the very beginning. And you need those three elements from the get-go in order to kind of maximize your chances of success. Other things you can bring on and build as you go, but I think those three have to be baked in from the very start.
Mm-hmm. One of the things that we've spoken about a fair bit with guests on the podcast is the importance of involving users and patients from the beginning. And I wonder if that is something that's changed over the last 20 years or so, or is that something that's been consistent in technology?
That's a very good question. I think I would say there are two answers. There's an industry answer and there's a sort of personal answer. So the industry answer is yes, absolutely. It has changed dramatically, and I'm really pleased to see the concepts of co-creation, co-design, co-production, all of which are slightly different things that are led and directed by different groups of stakeholders, including patients. And there's a better understanding that actually, if you want to, for example, address health inequalities, then you need to do the legwork of finding out how do you engage with those communities that inherently will always be quite slow to respond to your requests, and you need to figure a way around it. And that understanding and that attention is really welcome. I think there are those of us who would argue we've done that ever since ever, and we just used to call it collaboration, and before then we used to call it working together. And I can remember one of our very first kind of big projects, which was working in social care in the very early noughties, where we were told effectively to build an accessible database in order to help the senior managers do their bean counting. And we said, that's fine, we can do that, but the way you get that is by getting all your staff to use it, and the way you get them to use it is to build something that is useful to them. And so we insisted on engaging directly with staff at every level of the organisation across all departments, because we wanted to know what mattered to them in order to develop a system that was useful to them in order to meet the requirements of SMT. Now, for us at the time, that was sort of the way that you should do these things, but for the client, that was quite sort of revolutionary. And so it's really nice to see that now becoming mainstream.
Yeah. Let's talk a little bit more about the challenges that you see for technologists coming through, or, you know, people who are wanting to break into getting their innovation into the NHS, for example. What do you think are the biggest challenges there? We've touched a little bit on kind of the scale of how things are now. So it's not just local NHS trusts, it's a lot bigger and a lot more complicated. But is there anything more that you think is really tough at the moment?
I mean, right now, I would say it is really hard to be an innovator trying to get into the NHS, because the combination of the lack of funding that is well documented, coupled with the expectation that there's going to be a reduction in staff headcount pretty much across the NHS, and therefore staff are going to have to do more, work more efficiently, means simply that even if your solution is amazing and is proven to be so, a lot of your audience simply don't have the time or the capacity to hear it. And if they did, they may not have the budget to buy it. So I think if you're an innovator in the space right now, as we're recording in June 2025, what you need to do is find a way of having a really deep breath and allowing possibly 12 to 18 months for the healthcare system to get to a point where it's better able to engage. Healthcare knows that it needs to do this, but there are so many fires that it is fighting at the moment. There's a really limited capacity to pick up new innovation. I think beyond that, I see a lot of innovation that comes rightly from people who work in healthcare, who've identified a problem and then tried to come up with a health tech solution to address it. And it's only at that point that they realise that they really do not understand how the healthcare system works. And they thought because they worked in it, they could just get it deployed, and it doesn't work. So I think being mindful of that is really important. And I think for people outside who don't work already in healthcare, there's a risk of confirmation bias, that because you've had the idea and you've built it, you think it's the right solution. And you need to really look and see, well, how much of a problem is this for the system, not just a pet project for yourself? And what's the impact of the problem? Because if it's a genuine problem, but it has minimal impact and minimal cost and minimal patient effect, no one's going to buy it. So that kind of due diligence of validating not just your solution, but that the problem really exists to an extent that people would invest in buying your solution, are things that people could spend a bit more time on.
Yeah, so making sure it's the right problem that you've defined. Yeah.
Exactly.
Yeah. That's something we're really big on at the South Yorkshire Digital Health Hub. So we've, with our innovators, we've really encouraged them to use frameworks like the Double Diamond to spend time in that problem space to define and speak to a range of people to consider, this is exactly the right problem, or, there's enough of a problem here that a digital solution can solve.
Yeah, and the double diamond is a brilliant tool for that, because when it's done properly, it will reveal things that nobody in the room when they were walking in realised was a problem or a potential solution. And if you then have skilled innovators working with you, you can kind of begin to mock up interactive prototypes to work with that group quite quickly and quite easily, that then allow further intelligence to come out in a relatively short time. So I'm a big fan of that approach.
Yeah. Let's talk a little bit more about new technologies that you see coming into that's going to have a big impact in the next 5 or 10 years. I know AI is huge, obviously, and I think is often misunderstood about its capabilities or what's going to happen. So I wonder, what's your take?
Well, firstly, I agree with everything you just said. I'm not an AI expert. When I was running my company, we didn't work in AI, so I'm exploring AI myself, and I'm learning about it in little bits as I go. I think I agree with you. It's massively misunderstood, and there's this sense of it's going to take us over as human beings, which I think is a bit of a red herring, at least for the next kind of 5 to 10 years, certainly. But I think its potential and its impact is going to be massive, and it is going to be hugely disruptive. But in ways that actually might at first seem a lot more mundane. So in terms of more efficiently managing your diary and your email, being able to draft documents and create research proposals or tender documents or due diligence documents around, for example, data protection or meeting the NHS's digital technology assessment criteria, DTAC, those types of things. And that may sound really dry and really boring, but I can tell you from a business point of view, and that cliche of time is money, it will save huge amounts of hours of people's time. And if it's saving that time, it is also freeing up that time. So the opportunity then from an innovator's point of view is to say, how can I approach using AI in a responsible way to boost my productivity? And the answer to that is absolutely massively already across a range of technologies like Claude and Anthropic and ChatGPT. I know are going to release a new version quite soon, and they're incredibly powerful tools. You have to be careful how you use them, and you have to be mindful where your data's going, and especially again in a regulated area like healthcare. You have to be really careful that what you're putting into those systems is not sensitive information. But the ability to do a lot of your information governance and due diligence and then check it rather than have to create it is a huge potential boost to innovators.
Yeah. I go backwards and forwards with use of AI, actually. I think initially, perhaps in a bit of a Luddite sort of way, I was worried that if I used it, it was going to mean that I lose skills of writing or creative thinking, or, if I was relying on it all the time to kind of do those bits for me, then I was just going to get atrophy that muscle, if you like. But
I think there's that old adage of rubbish in, rubbish out.
Yeah.
So one of the things that I've had to actually become quite skilled in, and I'm still very much on that journey, I wouldn't say I'm there yet, is understanding how to write prompts properly for AI. So, initially, naively, you think, oh, just write me a document that will get me a £500,000 grant or something, and you do, and it's rubbish. And the reason it's rubbish is because you haven't provided the context, you haven't provided the background, and you haven't been specific on what sort of mode you want the AI to be in, and you haven't targeted it, and you haven't done your own research into knowing what data. So AI won't do all of those things for you. It's a funny thing to say about AI, but it's still quite dumb in that sense. And you need to treat it as kind of in the way that you might treat an intelligent but completely unskilled or uneducated junior worker, where you say, right, here are all the things you need to know, and then step by step, here are the things I need you to do with that.
Yeah.
That's actually quite a creative process. So I think there's an opportunity for creativity. You need to think of it as doing is speeding up processes that you could do yourself manually, but over a long period of time. And I think that we haven't touched on it yet, but there are genuine ethical questions around AI that I still struggle with as well, because the reason it's able to do what it does isn't simply because I've done my research and I'm feeding it the information. It's because of the LLM that sits behind it, the large language model, and all of the data that's been scraped to train it. And there is also a risk that if we're using AI increasingly, then that means the next generation of data is AI created. So we're generating AIs based on AI data. And that's why it's always incumbent on the human to take responsibility for it, that no matter what the AI spits out, you need to check it and see if it's valuable. So, for example, I'm going to a conference soon, a health tech conference, and I asked AI to produce an itinerary for me because I couldn't go to all the events because they overlap. And the itinerary it created was complete nonsense. It was total meaningless information. And I realized that that's because I hadn't been very clear with it about how to actually scrape the itinerary data in the first place. So I think there is a lot of learning to get the most out of these technologies.
Yeah, for sure. I think I heard someone yesterday, I was in a meeting about grant writing, and we were talking about using LLMs and how to use them well. And someone said, I use it to write my bios because it will be a lot more complimentary about me than I ever would. So I had a go yesterday. And it was giving me qualifications that I don't have. It was talking about me in, areas that I haven't really worked in. So I suppose, that's nice to hear you say about the prompting. I suppose I'm not very skilled in prompts probably. So getting better at that would help.
Yeah, certainly. I think I saw a quote recently, and I'm going to get it wrong, but it was the idea that most people fear that AI is going to take over their jobs, where actually there's an opportunity for you as an individual to become really skilled in using AI, and then you're the person who's going to take over their jobs, not the AI itself. And I think that's one of the core misunderstandings that exists, that AI is incredibly powerful and it is going to have a hugely disruptive impact across all elements of society, but not necessarily in the way that's generally understood at the moment. Yeah. I mean, there's also, isn't there, quite a lot of environmental issues with the use of AI that we don't have time to get into. That's not for today, but I think it's not without challenge, the increasing reliance or use of AI. I saw a comment recently that said that when you're being polite to AI, you are wasting energy and actually creating a bigger carbon footprint. I have no idea if that's true, but I thought it was a nice way to think about it. Don't be polite to AI. At the end of the day, it's just a computer. Don't treat it like an individual.
Doesn't have feelings.
No.
Great. Let's think about, so obviously you've been working in health tech for a little while, and I wonder if you could go back, would you do anything differently?
Wow, that's a big question. I think almost without question, yes, I think must be the answer. But and the reason I say that, I mean, don't get me wrong, we had a fantastic time, and the 23 years I was running the business, I really enjoyed, and I wouldn't take back. But and I see this a lot with innovations now that I'm kind of helping or just advising on. We were people who knew how to engage with customers and get the information that was needed and be creative and come up with good solid technology that was fun and nice to use. We didn't know anything about business. And I think that it's easy to go, oh, well, that's fine, and you'll figure it out. And we did. But we figured it out by doing everything wrong and making lots and lots of mistakes. And if I could go back, that's what I would do differently. I would understand that however much fun you want to have and however creative you want to be, that's great. It's not incompatible with being a proper, sensible business. And you could really shorten a lot of the learning curves we went through by having that understanding of business, and even just the basic things of, what's the real reason that you put together a 3-year business plan? Why is it important that you understand the breakdown of both turnover and expenses, and just ways of managing the business that are not kind of rocket science, but if you don't know to do them, you won't do them. And the impact of that is that you can drift from what you're trying to do very easily with massive consequences without kind of even being aware that you're doing it. So I think there is something about having that sort of professional business understanding in the room as early as possible, which we didn't do.
Yeah. I mean, it is a different skill set, isn't it? I think I keep reading about when PhDs become CEOs and the difficulty that comes into. And so it sounds like you're saying it's about the day-to-day running of a business. It's about the financials. It's about the strategy. Is there anything else that, in terms of running a business, that you think you'd really wish you knew sooner?
Well, I think it would have been good to have been sort of constructively challenged on some of our assumptions a bit earlier on. So, for example, we always took the decision, and we held this throughout our entire time, never to take external investment. So we did get tenders and grant funding, but we never did fundraising. We never did seed rounds and that type of thing. And we did it for what we thought were really sound reasons. But what we didn't really appreciate was the cost of doing that was that it meant our runway was always a lot shorter than ideally it would have been, because take up in regulated sectors like healthcare is really long. It can be 18 months easily. And also to do it is often very front-loaded heavy in terms of technical expertise and integration expertise and all the marketing costs that you need to do. So you need to keep going and you need to keep pumping into that, which we were really hamstrung by doing. So it's not to say that it was a right or wrong decision, but I think in hindsight, we would have done better to have been challenged and explored that a little bit more holistically than we were able to, because we just didn't have the knowledge in the room at the time.
Yeah.
What I would say is that there is much better support and there's a much better ecosystem to support SMEs out there now than there was when we started. Yeah.
So other than learning more about business and how to manage that, do you have any other advice for digital health innovators?
I think, and this is not unique to digital health, I think this is for everyone, getting out of that mindset of only you can do these things. You might be the person who understands the vision and kind of can get started, but you really need to learn to let go and get other people in to support you doing those things, and acknowledge that sometimes you're not the best person to do certain tasks, and get other people to do it. And it's really common. Founders fall into that every day, and it's a very difficult mindset to get oneself out of. So again, to be gently told, okay, get some money so that you can have a bigger team, so that you can actually focus on the things that really should be your attention and not all of this other stuff, whether it's, for example, running the business or doing social media or doing marketing or doing account management. It doesn't really matter, but there's probably people who know how to do that better than you. And rather than you learn it, you could focus on the unique set of skills and combination of motivations that you have that are really valuable and are not easily reproduced.
Yeah, really sound advice. So build your team.
Exactly that. Yeah, you've said it much more succinctly.
Oh, Lorenzo, it's been great to speak to you this morning. Thanks so much for your time.
Thank you very much for having me. I've really enjoyed it.
Huge thanks to Lorenzo for sharing his insights and experience. In summary, we explored the evolution of the health technology sector from the paper-based world of the 1990s to today's digital landscape, with more regulations, greater complexity, and more emphasis on co-designing solutions alongside users, and why understanding the problem is just as important as building the solution. We discussed the growing role of AI, not as a job stealer, but as a productivity partner, and the need for ethical and thoughtful use of these tools. I echo Lorenzo's reminder of the importance of building a team and letting go of trying to do everything by yourself. And maybe don't underestimate the value of developing business skills. If you've been enjoying the podcast, please do like, subscribe and share, as it really helps more listeners find us. Thanks so much for listening, and I'll see you next time.